So ADHD in women looks completely different to what you would expect. So my name is David Campbell. I'm a GP with a special interest in ADHD. One of the more confusing parts about ADHD is how it looks across both genders and the lifespan, because we're kind of conditioned to think that it just affects kids at school. And what we see is that there's hormonal and biochemical reasons that actually looks different in women. And the main reason for that is the higher levels of estrogen is protective on the frontal part of the brain, where we see a lot of the hyperactivity. So because we don't see that in women, it gets underdiagnosed. And so we don't see as many diagnoses in women. So you see more of the inattentive picked up in school, and that's where you get the classical ditzy little girl who gets put on a stimulant. But if they don't fit that criteria, they can easily get missed, and they only get a lot of the internal symptoms, which can be emotional lability, getting quite frustrated, and a lot of anxiety and atypical types of low mood and depression from these racy thoughts. So they still have the hyperactivity, but they just don't have it externally, so we can miss it, but they do have it internally. And that can present and be quite traumatizing, because they really don't get a good answer of why they feel the way that they feel. It's actually quite rewarding when you see females who have struggled with these mental health-like symptoms for a long period of time and not responded to regular mental health treatments like SSRIs and psychology and different things, respond very well to a stimulant. It's kind of atypical to what you would expect, but you actually see a complete reversal in their symptoms if that's the correct diagnosis. So in summary, ADHD looks completely different in women, and that's an important thing because it can actually provide a lot of care for a huge part of the population that gets missed. So if you want to find out more, just give us a buzz at Mingara Medical.